Good day viewers, my name is Adjene. I am a 100-level medicine and surgery student of Babalola University, the Department of Medicine and Surgery, the College of Medicine and Health Sciences. Doctors are all about saving the lives of patients. However, in our society today, disease is threatening the lives of numerous people each day, and I'll be here to talk about one of them, tuberculosis. I choose to talk about tuberculosis because in our society today, it is the third most deadly disease and it is the second leading global killer, infecting almost 2 billion people and causing the loss of over 1 million lives worldwide. So now let's go into details. What is tuberculosis? Tuberculosis, or TB for short, is a pulmonary airborne disease that attacks the lungs. It is caused by Mycobacterium tuberculosis and it can be transmitted, though not as easily as other diseases. Two forms of the disease have been identified. There is the latent or inactive tuberculosis, where the individual is infected but cannot show symptoms or spread the disease. And also there is the active tuberculosis, where the individual is infected and displays visible signs and symptoms which can be transmitted. Such symptoms include chronic coughing with blood, fatigue, loss of appetite, fever, chills, weight loss, night sweating, chest pain, and even lung damage. These are all symptoms of normal pulmonary infection. When complications arise, the patient develops extrapulmonary infections, which are identified by symptoms such as spinal pain, meningitis, joint pain, kidney problems, liver malfunction, heart disorders. Now let us find out, how does a person get infected? The disease is caused by the spread of the bacteria through tiny droplets released into the air by the infected person, either through sneezing, coughing, or even by laughing or talking. When a healthy individual breathes in the air, he or she may become infected, but this depends on how close the individuals may be, as it is easier to get infected from people you regularly engage with, like your family members, colleagues at work, or friends. Major risk takers for tuberculosis, however, are people who receive poor medical care, drug or alcohol addicts, people with weakened immune system, those living in tuberculosis endemic areas, and people having regular contact with others that are infected with tuberculosis. Let's take a look at how we can prevent tuberculosis. One of the ways of preventing tuberculosis is by staying in ventilated rooms. Another is by reducing contact with infected people. Also, covering your face, or better yet, wearing a mask that covers your nose and mouth will help reduce your exposure to the air. Taking vaccinations for tuberculosis, especially when traveling, and completing all prescribed medications can help you gain higher immunity and achieve full recovery. But if prevention fails, then what is the cure for tuberculosis? Treatment usually depends on diagnosis by a doctor, but common antibiotics used include rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Though at times the bacteria may be resistant to some of these drugs, newer drugs and vaccines are being developed to stop this disease, one of which is Cetro, which is used particularly for multi-drug resistant tuberculosis. Thank you for watching. I believe you have now learned a thing or two about tuberculosis. Please stay healthy and stay safe.